All right, we are back on Morning Line on this Monday. Thanks for joining us. Nick Beres here. The number on the screen, 737-7587. What do you think? Is it safe? Would you, if you have a child at school age, want to send them back in-person class or keep them virtual learning? Maybe it depends on where you live. Give us a call and let us know. With us this morning is Beth Brown. She's with the Tennessee Education Association. Good morning to you, Beth. You got me loud and clear still?
Good morning.
There
yes.
You are. Hey, I'm trying to think. Have you been into some of the schools of late that are doing in-person classes? I have a family friend that lives in the Cookeville area, and they're back in schools, and their son tells them that the hallways are as packed as ever, and most of the kids aren't wearing masks. And I'm like, that's idiocy is what that is. So, I mean, is it like that? Because I remember when I was in school just how packed the hallways can be. And if that's happening, I mean, have you seen it to that level, or is it supposed to be different than that?
Well, I will tell you that when I was able to go out and visit some schools earlier in the fall, it's been several months. And so a couple of those factors are going to vary district by district, whether or not there's a mask mandate in schools. Of course, the Tennessee Education Association has certainly advocated for a mask mandate in all schools because we know that it's an important mitigation measure. And then there were some schools on my tour where they met me at the door and they said, okay, hi, thanks for coming, but you're not coming in. So the protections were really, really vary by district and by school, whether or not they're even allowing people to come in. Again, some schools have a mask mandate, some do not. But I will tell you, as a high school teacher, this is my 20th year in education. I've taught only high school. I know exactly what those hallways look like. And there is no way to socially distance in a hallway, particularly in a high school hallway.
Yeah, and like I said, some of these schools, maybe there where he lives, my family friend, may have a policy, but it's just getting it to enforce and make sure all the kids have their nose covered and stuff. He's like, it's just not happening. We've got Doug on line one. Doug, good morning. Hi, Doug. What's on your mind?
I'd like to know why some teachers still have to be in school and other teachers don't. I mean, the special ed teachers still have to go to school. They're hands-on 24/7 with that child from the time they walk through the door to the time they leave the door. And some of them are exempt from wearing masks. And my second point is, everybody that says, well, we need to stay out, they still get a paycheck. The people that don't get a paycheck, it's killing their family's economy and killing them from being able to provide for the family, making more of a burden on the social system. And the third thing I'd like to know is why is the progression of shots that are supposed to be distributed, why don't the teachers of special ed kids have the same priority as far as their shot as what the school nurse would have? And I for the answer.
Yeah, Doug, let's start with Doug's last question there, because that was one we were talking about during the break that I think is very important. A lot of people are wondering, the different phases of the vaccines. In 1A, we know who qualifies in that, but you want to open up the schools and get it going and have teachers protected. Why aren't they in 1A? I think they're in 1B, aren't they, Beth? And so the vaccines haven't started yet, have they, for most teachers?
So there multiple parts there. So yes, educators were moved up in the priority list to 1B. The TEA certainly supported that decision, moving educators up in the priority list behind first responders and medical workers. What we are seeing, there are some educators in the state of Tennessee who've already received their second vaccination shot. There's many more, however, who have not received their first shot, and it varies county by county, and it, as to how many people are actually fit into category 1A. So they got to work through all of 1A before they can get to 1B. And so depending on the county and how many people in that county fit into the 1A category, that's going to impact how quickly educators have access to the vaccine. The other factor that influences how quickly educators can have access to the vaccine is the supply and demand chain. My understanding is, and when you look at the Tennessee Department of Health website and you look at the list of counties, there are some counties where it says we don't have any vaccines available at all, and in most they have very limited vaccines. And so until we can get more vaccine down into our state, it's going to be very, very difficult to get our educator workforce vaccinated.
But getting them vaccinated, that would be the answer. If there was, enough of the vaccine, and hopefully that'll kick up and we'll see more of it available soon. Isn't that one big solution? If we can get all the teachers vaccinated, then that pretty much makes the point moot, doesn't it?
Access to the vaccine is critical to moving back to in-person instruction for all. Yes.
Yeah, I mean, that's a no-brainer. That's true of, I guess, just about every field where people have to work at home for whatever reason. One of his other questions along the lines of, is it true, though, that some of the special ed teachers are going back sometimes when other teachers in the same school may not, just because of the nature of what they do? I'm not familiar with that. Do you know? And maybe that varies from district to district.
It is. Again, Tennessee's very much a local control of public education. There are some students who have special needs that are requiring educators to come into the school building. I couldn't say for sure about Metro Nashville if that's occurring at all. I do know that there are some districts where special educators are educators who work with students who are medically fragile or have other exceptionalities. It's a very different working situation for those educators than for, say, someone like me who teaches a high school English class. And it's, what we're seeing is a commitment from districts to continue to try to meet the needs of those students that have exceptional needs. And there are state and federal laws that protect those students' needs. And so districts are working very hard to comply with law and meet those students' needs and keep everyone as safe as possible.
Gotcha. I know you got to do a balancing act there. Beth, let's go to Taylor. He's called in and see what he's got to say. Taylor, good morning. Hi, Taylor.
Good morning, Nick. Good morning to your guest. I will start off by saying my children are beyond K through 12 and beyond college, but I do have a few remarks that might offend your guest, but I think there's a real problem, especially for the K through 5 or 6 population in this state. I'll start out by saying their math and English skills were only 34% proficient before the pandemic, and now it's dropped even below that. So obviously there's enough concern for the governor to attempt to make some changes. I will say that apparently as much of a problem in the schools this year has been more so than the pandemic, or because of the pandemic, the absence of teachers, and of course the substitutes feel like they don't get paid enough to take any chances. So the union, which this lady represents, I wish I knew exactly how many teachers have died from this year. I'm sure the number would be much lower than a lot of other professions that are working 40 hours a week on the job who get exposures as well. So, of course, in most cities, those with the heaviest teachers unions are the ones that are fighting over in school or out of school. Private schools across the nation are not suffering anywhere near the absence as is the public schools, which need it worse than ever. So my point is, the union, and I'm not trying to just pick on the union, but in fact, those teachers have a higher rate of absence, more insurance claims than the non-union members. And there's something wrong with that. And of course, they oppose this governor. And so I just think we're not getting the true story with this problem because nationwide, the young children are not dying of this disease, and most aren't even suffering serious consequences. Although, of course, there might be some that have, but the numbers are over-exaggerated, and the absence of teachers in the classrooms is under-exaggerated. So.
All right, let's, do you want to address some of that and maybe, talk about the role perhaps of the union? And he used an example of looking at what's happening in private schools and if that's a fair comparison in your mind.
Okay, so I'll address both of those. First of all, the Tennessee Education Association is, in our local affiliates, our job is to advocate for Tennessee's educators and students and to help advocate for the best policies possible at the local, state, and national levels. That's what we do. We are very bipartisan in that effort. I will say in regards to teacher absences that he mentioned, I know that there are educators who have had to be quarantined multiple times. So when you're talking about being absent from school, there are educators who've been quarantined up to 3 times this year who have exhausted the COVID leave provided by the federal government and who are now actually losing pay because they've been quarantined so many times. And the comparison between public schools and private schools, I think, and I'm going to say, is an unfair one because our public schools do not have the resources that private schools do, and we have a lot more students that we have to serve. And so I don't necessarily think that that's an apples to apples comparison. And I would add one more thing,
Sure.
if you would allow me. The idea that, and I'll reiterate something I said earlier in the show, educators are working harder than ever. There was a reference to other career folks who are working, their full 40 hours a week. I will tell you that the TEA conducted a survey in the fall to gauge how our educators across the state had fared. And on average, educators worked an additional 230 hours over the course of the semester, an additional 5 weeks, and we're averaging 50 to 60 hours a week. So educators are not sitting at home, not doing their jobs if they're teaching remotely, and many of them across the state are in person. Educators are working harder than ever.
Yeah, and I might have asked Taylor this, and I understand Taylor's a smart guy going through that, maybe what he thinks, because at least in my experience, being around teachers, whether they're private or public school teachers, they love what they do. They're sure as heck not getting rich doing it. They do it because it's something they want to do. And so I'm trying to get a sense here from those who are saying, well, what's wrong with these teachers? Why don't they want to teach? I mean, my take is that they want to do it safely. That's kind of just where I'm coming from on this, is that, they're not home trying to get out of this and get paid and not do anything or cool their heels while they're doing it virtually because they want to. I think 100% of them would say they'd rather be in the classroom if they felt they could do it safely, but they don't want to put their own lives at risk, okay? Or sicken any of these youngsters. Taylor's right. Most youngsters don't die. It's not just about the youngsters, though. So the kids get it and recover, all right? But maybe the teacher who's older gets it and dies. That's a problem, okay? So I don't know. I mean, that's my attitude, is that most of the teachers, I think, want to be in the classroom, okay? They want to. That would be their first choice. Number one, and there's no, hidden well, they just like staying home every day and doing nothing, which is baloney. So is that not the case? I'm trying to figure out the logic behind people who are critical of this, except for those out there who just don't think that COVID's a big deal. And if that's you, you're a fool. So what do you think? Most teachers want to be in the classroom, do they not?
Absolutely. Nobody wants to resume in-person instruction more than Tennessee's educators. We absolutely want to be back in our classrooms with our students because there's nothing that's better than in-person instruction. That said, we do have to worry about the health, safety, and well-being of not just our students, but our educators. I heard from our governor last week that you can't believe in public education and believe that in-person instruction is unsafe at this time. And I just could not disagree more. Our schools are, yes, Our priority is our students. We cannot have public education. We cannot have public schools without adults. And you cannot discount the risk to adults that we're experiencing in COVID-19. When you track the data in our state, what the data shows is that educators are being infected at a much higher rate than the adults in the general public around the state. And you cannot ignore that fact. We cannot have schools without adults. That's why so many districts have had to go to remote learning for a period of time, because they didn't have enough adults in the buildings to actually staff the classrooms. And in some places, we had so many adults who were under quarantine because of either exposure or infection that students were being housed in the gym. You're talking large groups of students being put in a gymnasium because they didn't have enough adults in the school for them to have class.
Yeah, think about that. Let's go to Angela next. Angela, good morning. Hi, Angela.
Hi, good morning. How are you?
Good.
I have a comment and also a question.
Okay.
I am sure maybe that they're working harder at home, but as from experience watching my grandson on remote learning, a first grader in the Metro School District, the information is not getting across to the kids. It is not. There is nothing like in-person learning. Mm-hmm. And I also feel that he has slipped so far behind. He hasn't learned anything this year, anything. It got so bad that my son and my daughter-in-law actually sold their house in Nashville to move to another part of Tennessee just to get their kids in school. Another question, for every problem, there's a solution. Why can't the days be split? Why can't you go Monday, Wednesday, Friday, and Tuesday and Thursday? Thursday would be remote. And then the second part of those classrooms would go the following week, Monday, Tuesday, Friday, and then Thursday, and whatever. And then high school, why can't you do 9th and 10th grade and utilize all those classrooms, AM, and 11th and 12th PM? There's a solution, but nobody, I feel, is putting the effort to find a solution to those problems. You would have enough classrooms in high school if you split that day, AM and PM. I went to a high school where 9th and 10th grade went in the AM and 11th and 12th went in the PM. And this was because of problems with, interacting with other people. But this is a solution, and you have enough classrooms to do that. There's no reason why you can't.
Okay, hang tight on that. We're right up. Can you stay with us for another segment, Beth?
Sure.
Okay, yeah, thank you so much. I want to give you a chance to talk about what options have been looked at and the like, and that's a fair question from her, and she definitely sees that with her grandchild and having some issues with that, and that's a concern for every parent. Again, the balance here between teaching and safety is what it all comes down to. So good question. Stand by, Angela. When we come back, we'll let Beth address what you asked right after this. Stay with us.
This is a Storm 5 weather update. For weather on the go, download the Storm Shield app.
I'm News Channel 5 meteorologist